What's happening to veterans' healthcare with changes at the VA under the new administration? Our guest, Allison Gill, is a veteran and worked at the Department of Veterans Affairs for over a decade. Welcome to Care Talk Live, where we talk about how healthcare works or doesn't work in America and get you answers. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Please text or call in your health insurance and healthcare questions at 202 838 6837, and our experts will answer them in future episodes. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get the next week's Care Talk show. In today's episode, Dr. Gill talks about how the VA healthcare works and changes that veterans should know about. So, welcome. Allison Gill owns and operates a podcast network of independent creators dedicated to news, politics, and justice called MSW Media. And this podcast is a part of it. She also hosts the Mueller She Wrote podcast and co hosts the Daily Beans and Cleanup on Aisle 45 podcasts. Her career is dedicated to the advocacy and welfare of veterans. Welcome to the show, Allison.
Oh, thanks for having me, Laura. I'm glad to be here.
Thanks. So I'm hoping you can tell our audience more about what's going on at the VA and for veterans healthcare more generally. It seems like there's been a whole lot of chaos over the past few months, starting from the very top.
Yeah, and I think we can say that for pretty much any federal agency, particularly with DOGE coming in and putting a hiring freeze on everything and enticing people to quit their jobs either through deferred resignation program, the fork in the road email, by not backfilling vacancies, and of course, by returning everyone to the office who might have been on remote work or telework into really horrible conditions that are actually really bad for patient privacy, because there's like 10 people in a bullpen with no expectation of privacy if they're speaking with patients or veterans. And that, was designed to, make people want to quit their jobs. So all in all, they've lost about 30,000, and they were going to RIF, or reduction in force, another 50,000 for a total of 80,000. But when they ran up against the legal problems with that, they stuck with their original 30,000 attrition through getting rid of the probationary employees and the fork in the road stuff. And then, once they had about 30,000 people gone, by the way, a third of whom are veterans themselves, they said, well, we're not going to go into the RIF quite yet, but the consequences have been pretty devastating.
So let's talk about that. How are all of these cuts to VA personnel affecting veterans who are trying to get their health care?
Well, never in my 11 or 12 years of working at the VA did we sit around and say, man, you know what, we're just too overstaffed. We just have too much staff, not enough work to do, because of Republicans and cuts and means tests and all those other things and budgetary restraints over the decades. The VA has always been woefully understaffed. And so this is going to impact them, and it has impacted them pretty directly. We see a lag in patient care. We see lower patient satisfaction scores. We see, and it's not just with the personnel leaving too. It's a lot of the new policies that are being instated by this administration via fiat executive order, that are also hurting veterans and their health care. I went to the VA a couple of weeks ago, and two things of note happened. First of all, they didn't have any COVID vaccine to give me, and we're waiting on getting the new one, which comes with more restrictions than we're used to, including if you're under 65, you now have to have an underlying condition in order to be able to get the vaccine. And sorry, I have a cat hair in my eye, and it's been bothering me since we started. So that's why I'm doing that. But so there's that. And then, some other things too, like as I was sitting in the waiting room, I was shown this ICE recruitment video, how they want veterans to come and work for ICE and get a $50,000 signing bonus and get student loan forgiveness and all of these other things. And instead of the, normal Fox News that's usually playing in the lobby, sometimes CNN, depends on what city you're at, what VA you're at. But to have on a loop a 3-minute ICE recruitment video playing in the waiting room was kind of disturbing, to say the least.
And let's talk about there's some specific policies that they're trying to restrict access to women's reproductive care to veterans. Is that right?
Right. The law says, and Biden and the legislature back in 2022 sort of said again, because the legislature passed this law a long time ago, and Biden sort of reiterated it, that, abortifacients, for example, mifepristone, are allowed to be prescribed by doctors at the Department of Veterans Affairs. And this particular new administration doesn't want that to be the case. So there was an open public comment period that ended on September 3rd. For people who wanted to continue to be able to get mifepristone through the VA. Veterans want to be able to get that. And they, I think, want to put an end to that, even though that would be illegal. But again, in the meantime, while we argue that in court, because I'm certain there will be lawsuits, it takes access to reproductive health care away from our veterans. And I did speak to a doctor who continues, one of the few left that continues to prescribe mifepristone out of Nevada, especially to veterans in other states that have anti-abortion laws. And she's very concerned that, not only will changing this rule completely stop that practice from happening, but because she was one of the only doctors left, even though it's still legal to prescribe it, there was a huge chilling effect on providers who feared that they would be prosecuted or lose their licenses or any number of retaliatory things that could happen to them if they did prescribe these medications. So sometimes it's not always about the law or the executive order. It's about the chilling effect that it has on providing healthcare to people.
Yeah, we're seeing that with access problems, like you mentioned, to the updated COVID vaccine. Like I myself have not gotten my booster yet because my insurance company, it wasn't available in Virginia in my area until today. So that's some of that's logistics, and some of that is the chilling effect from the very top, from RFK Jr. on down, on who can get access to what medications and what treatments. And speaking of who can get access to what care, let's talk about this administration's efforts on privatizing the VA.
Yeah, and this, aside from the complete gutting of personnel at the Department of Veterans Affairs, to me is the biggest threat, is the attempts to privatize the Department of Veterans Affairs. If you'll recall, back in 2014, there were some wait list issues with the Department of Veterans Affairs. There were long wait times to get in. And John McCain's co-sponsored a bill with some Democrats, and I think even maybe Bernie Sanders had signed on to this, called the Choice Act. And so let me just really quickly describe the difference between direct care and purchased care through the VA. Direct care is care that you go to a government facility, a VA facility, get care by a government doctor, and the government, that's just part of their budget, right? There's no third party to administer a claim or anything like that. So that's direct care. It is cheap and it's better. And then there's purchased care. And we've had purchased care, community care at the Department of Veterans Affairs for decades. So let's say you go to your local Department of Veterans Affairs, your Veterans Health Clinic, and they don't have a hand surgeon and you need hand surgery. We are contracted with a local private hand surgeon who will do the procedure. And then there's a third-party administrator or a third-party contractor, usually somebody like United Healthcare or TriWest or some, big healthcare conglomerate that will, adjudicate that claim and have the government pay that private doctor for that particular procedure. Now, the doctors who are providing purchased care to veterans can charge up to 115% of Medicare rates. So it's more expensive to the taxpayer because the taxpayers pay for those procedures. And it's also not as good of care. It's not as high a quality of care as direct care, as shown by the outcomes, the health outcomes and customer satisfaction, veteran satisfaction surveys. So what they did in 2014 was to say, let's temporarily expand purchased care so that we can get these wait times at the VA down. We're also going to approve $12 billion to infuse into the Department of Veterans Affairs to build new clinics and hire more doctors and beef it up so that we don't have this wait list problem again. And once we've got it beefed up and we've infused all this money, we can stop that expansion of purchased care because it's more expensive for the taxpayers. It's subpar care compared to what we provide here at the VA, because the VA is designed specifically to care for the complex needs of veterans. And yay, and then everything will be hunky-dory. And in Trump's first term, that was 2014. President Obama signed it into law. I was there and I helped implement the increase in purchased care. And we saw the numbers go down. We saw wait times go up. We saw it become more expensive. We saw our budgets being drained. And so then when Trump was in office the first time, he wanted to completely gut the Veterans Affairs and healthcare for veterans and benefits for veterans. But his adults in the room said, if you do that, you're never going to win re-election. So instead, what he did was he made the Choice Act permanent, which means now veterans can go get purchased care whenever they want. It's not limited. There's no right of first refusal for direct care because direct care is better. And now they're extending the approval of purchased care to a year instead of per instance. You have that opportunity to go get that purchased care for a year now. And they have upped it to about 65% of what the care received by veterans is now purchased care. So they're trying to privatize the entire VA, which makes it more expensive for taxpayers and results in lower quality of care and longer wait times for veterans. And eventually, I think they want to get to 100% purchased care for the Department of Veterans Affairs, which would be devastating. And for decades, as you know, veteran service organizations and veterans themselves have long pushed back against privatization of the Department of Veterans Affairs. And that's kind of where we're at. And, honestly, Laura, all of the extra money that the taxpayers spend to adjudicate these claims that go to United Healthcare, all this extra money that goes to even a third party place that like WPS that just handles the money part of it, and then the money that goes to the banks for fees and all that other stuff, all of that money, if you just gave direct care to every veteran, it would be cheaper than you could actually give direct care to pretty much most Americans for that cost. Especially since we're one of the only, I say, like I still work there, but the VA is only one organization until Biden that allows to negotiate for Medicare drug prices and lower drug prices. So here we are again with the Republicans back in control and no adults in the room. And they just want to completely privatize the entire system, give all the money to United Healthcare, put AI software in to deny veterans claims like they do with the rest of our healthcare in the private sector. And it's a terrible mess, and it's going to result in a lot of deaths. And it's very, very frustrating to watch.
Mm-hmm. To me, it sounds like there's some similarities with traditional Medicare and Medicare Advantage, which is, again, taking money and sending it to private insurance companies that are for-profit entities. So then they're getting their profit. And in theory, they have incentives to deliver cheaper, better care. But in practice, it just turns out that it's more expensive care.
Yeah. And that's why I think Medicare for All is great. And I think it's a great stepping stone, just like the Affordable Care Act is a great stepping stone to Medicare for All. But for me, it's not the end goal. The end goal is direct government purchased care, or direct government care for individuals. No third party, no fourth party, no administrative fees, nothing. I mean, it would be so cheap to do, and the health outcomes would be so much better. And I don't know, and, a lot of Republicans say, well, we wouldn't have the research. We wouldn't have the great research. But the VA, every single Department of Veterans Affairs teams up with a research arm of a major university. Here in San Diego, it's UCSD. And all of those nurses in training and doctors in training do a stint at the Department of Veterans Affairs and get that kind of complex, amazing training. And in return, we share all our research data and do research together and come up with incredible new clinically indicated treatments. And I mean, it's boundless and endless how much we could move forward in healthcare and advancement in technology.
Well, you may not have an answer to this, but for all the veterans watching, if they're concerned about privatization and, worse quality of care, is there anything that anybody can do right now?
Yeah, the veteran service organization lobbies are very strong. These are like the Purple Heart Foundation and Veterans of Foreign Wars, things, the VFW, things like that. Those veteran service organizations have a lot of sway on the Hill. And a lot of this stuff is supposed to have to go through Congress, right? And so those people have to be elected again. Donald Trump doesn't. And, whether he does a coup to stay in power or, just actually leaves, I don't know. Doesn't matter. He doesn't have to get elected again. He doesn't have to face a vote again. But our electeds on Capitol Hill do. So my advice would be to contact and join your local veteran service organization and ask them, what can I do to help stop and push back against the privatization of the VA? Because they have long-standing, do not want that. They fight very vehemently against it. It's why, to this day, the VA has not been privatized as much as it is right at this moment. And they have, like I said, a lot of power and sway as a lobbying organization to the elected people, the people who have to be reelected on Capitol Hill.
Well, thanks for joining us today. And how can people follow on with your work? How can people find you on the internet?
Well, I recommend, if you want to get your news without feeling overwhelmed with a little bit of appropriate profanity, The Daily Beans is a great daily news podcast. You can also check out my Substack at MillerSheWrote.com. I go there live a lot. And I have a new video podcast on Midas Touch that I also post on my Substack that you can now watch if you're so inclined. I was so against doing video. I'm like, no, I don't want to do video. I've been doing audio for 7 years. Don't make me wear makeup. So you can catch my video pod sans makeup because I refuse to pay a glam tax. But that's, I'm pretty easy to find and follow. So I appreciate it.
Well, thank you so much. And now our experts will answer your health insurance questions. Welcome to Diane Archer, founder and president of Just Care USA and senior advisor on Medicare at Social Security Works, and Louise Norris, health insurance and healthcare reform analyst at healthinsurance.org. So let's start with the information that everyone should be thinking about is open enrollment is coming soon for Medicare, Affordable Care Act, your employer-based insurance. Usually everybody does open enrollment for next year's plans in the fall. And there's going to be many changes that you need to pay attention to, regardless of where you get your insurance. So, Diane, what should people on Medicare be looking for?
They should be looking for those many changes. What we know from the Kaiser Family Foundation is that a lot of people don't pay attention during open enrollment season to these changes and end up sometimes in the same plan that they had been in, but at much higher cost to themselves or with fewer benefits. So what we now know is that the insurers are planning to pull out of Medicare Advantage in some areas. And that means that at least 1.5 million people in Medicare Advantage will need to be looking for new coverage. In addition, other insurers will be pulling out of their Medicare Part D plans. That's for prescription drug coverage. So if you're in traditional Medicare, you're going to need to be looking for new prescription drug coverage. And we'll say more about this during open enrollment season, but right now we just want you to be aware that a lot is changing this open enrollment season, and you should, to save money and to get as good a health care as you can, you should be ready to look at your options.
Thanks. And Louise, what should people on the Affordable Care Act be looking for? And I am one of them.
As am I. So we will be addressing a lot of this as we get closer to open enrollment for Affordable Care Act plans. The open enrollment period starts November 1st, so we still have several weeks before that begins, and we'll be covering more details as we get closer. But just like Diane mentioned for the Medicare market, there are also changes in insurer participation in the marketplace plans for people who buy their own coverage. It's not just exits, there are also some entries. So it varies by state. Some states It's just the same carriers that offer coverage this year will continue to offer coverage next year. In other states, there is one or more carrier exiting the market, and in other states, carriers are entering the market. Some states, there's both. There's a carrier entry and a carrier exit. Obviously, this matters in terms of your options. The options that are available to you are going to change if the carriers that participate in your marketplace change. If you are on a plan that is ending because your carrier is leaving the market, in most states, the marketplace will automatically shift you into a new plan if you don't do anything, but that is not in your best interest because you're just getting moved to a plan based on an algorithm. So it's always better to comparison shop and pick your own replacement plan if your plan is ending. If there are new plans coming into your area because a new carrier is entering, then one of those plans might be a better option for you. So again, comparing your options, looking during open enrollment, even if your plan keeps on being available, there might be a better option for you. The other thing to know about carriers entering and exiting the market for marketplace plans is this can affect the size of subsidies that people get, because your subsidy amount is based on the cost of the second lowest cost silver plan in your area. If the carrier that was offering that plan leaves, or if a new carrier comes in and undercuts the current market and takes over that, what they call the benchmark position, it changes the subsidy amount for everyone in that area. So there's a lot that changes with carrier participation, and it's just the overarching take home here is pay attention to any notices you're going to get from your insurance company and from the marketplace as we head into open enrollment, and then really actively comparison shop to make sure you're in the plan that best meets your needs for next year.
Thanks, Louise. And a question or comment from YouTube. This person said that cuts will affect everyone, even if, talking about the recent budget bill that just got signed into law. Cuts will affect everyone, even if they aren't on government-supported healthcare like Medicaid. Everyone will pay more because the health companies will raise rates across the board. So, can you talk more about how cuts to Medicaid or cuts to any form of service like the Affordable Care Act, how cuts to care and fewer people covered will affect everyone?
Yes. So basically, this is, I think, probably in reference to the One Big Beautiful bill that was enacted earlier this summer, because the primary cuts in there were to Medicaid. There are some cuts to Affordable Care Act coverage, but the bulk of the coverage losses from that bill are in Medicaid. And so then people who aren't on Medicaid might wonder, well, why does this affect me? And the takeaway point here is people who lose their health coverage still need health care. If they're uninsured, the most likely place they're going to get that care is the emergency room, because they may no longer have the access or affordability to get primary care. So they end up in the emergency room once it's become a serious situation. That's the most expensive place to receive care. And the emergency room can't turn you away due to lack of ability to pay if it's they have to assess you and stabilize you. So what ends up happening is this turns into uncompensated care for these hospitals, because there's no way to pay. The person can't pay for that care. And so they pass that cost on to everybody else. So then it's not an immediate effect, but it's sort of a ripple effect over time. You see private insurance companies, employer-sponsored plans, they start to increase their premiums because the hospitals are charging more to the people who have coverage to make up for the fact that they're having to provide care to people who don't have coverage. So there's no islands in this system. We're all one big country. And when you raise the number of people who don't have health insurance, you are going to push those costs onto people who do have health insurance. So this should matter to everyone, regardless of where you get your coverage.
And the next question is for Diane. How can people avoid inappropriate Medicare care denials?
It's a really good question. The answer is that the easiest way to avoid inappropriate Medicare denials is to enroll in traditional Medicare. Here's why. In traditional Medicare, you're covered for the reasonable and necessary care your treating physician says you need in almost all cases. And that's because the government's financial incentive is to ensure you get the care you need. That is what Medicare, government administered, does. But if you're in Medicare Advantage and an insurer is paying for your care, the insurers have a financial incentive to deny care. The less care they cover, the more money they keep. And so they profit more the more they deny care. And as a result, not surprisingly, there have been 2 reports out of the offices of the Inspector General showing widespread and persistent inappropriate delays and denials of care in Medicare Advantage. In addition, in Medicare Advantage, you're going to need to go through hoops, usually prior authorization hoops, before you can get costly care. And that's the place where you can face more denials, but you also can face delays in getting care, because even if the insurer isn't denying your care, the prior authorization process can take a long time. So one more piece of advice, which is even if you're in Medicare Advantage and you're facing a denial, you do have the right to appeal. You have the right to appeal if you're in traditional Medicare as well. And you have an 80% chance of winning that appeal, meaning that you will get the care that your treating physician says you need. Most people aren't aware how easy it is to appeal, at least at the first couple of levels, where you just basically have to say to your Medicare Advantage plan, please review this determination. And again, you'll have an 8 in 10 chance of prevailing. And even if you don't, you can appeal to the next level, usually with the help of the treating physician. It matters. And then again, you have a high chance of prevailing and getting the care that your doctors say you need. But again, you're going to be receiving delayed care. And in many instances, you need care urgently. And so my advice is, if you can enroll in traditional Medicare and want to be able to get the care that you need when you need it, that's your best bet.
Thanks, Diane. And Louise, can you talk about how to appeal if your claim is denied in a non-Medicare plan?
Sure. And I think, just how to avoid claim denials in the first place is a good place to start. If you're under 65, you probably don't have an option to go on Medicare. So in most cases, you are going to be on private health insurance, either offered by an employer or purchased in the individual market. This is assuming you don't qualify for Medicaid. So all of these insurance companies use things like prior authorization. Step therapy is an example. This is where if you get prescribed an expensive prescription drug, your health plan might say, well, we only cover that drug if you have already tried a different drug that's approved for the same condition, but that's less expensive. If you try that and fail, it doesn't work, only then will we cover this more expensive drug. That's called step therapy. And then provider network rules. So I think as far as avoiding claim denials in the first place, it's really important to understand your specific plan's rules with regards to prior authorization requirements, step therapy requirements, and then network requirements. If your plan doesn't cover out-of-network care and you go to an out-of-network provider, it's not going to be covered. So knowing that ahead of time and making sure that you find an in-network provider, or if there is no in-network provider, you work that out in advance with your health plan. You contact them in advance and try to get an exception from them in writing. You don't just go to the out-of-network provider and then hope for the best after the fact, because guaranteed they're going to deny that claim. Same thing with prior authorization. If your plan requires prior authorization for a certain procedure and you get the procedure done without the prior authorization, the claim will be denied, even if it would otherwise have maybe been approved if you had gotten the prior authorization. So this is where talking to your plan ahead of time and knowing what the rules are, and getting your doctor involved in this too. Your doctor will be your advocate for helping you get that prior authorization. If your plan requires step therapy for a drug, your doctor will, can either prescribe the lower cost medication first and then document whether or not it works, or if they don't think it's suitable in your case, they can file an appeal for you to your health plan. But it's keeping this communication open between yourself, your doctor, and your health plan. And then, just as Diane mentioned, for Medicare, there are appeals rights in the for private health insurance too. You can appeal if, like, say for example, you submit a prior authorization request and the insurance company denies it. You don't just have to accept that denial. You and your doctor can appeal. You can appeal directly to your health plan. Even if they reject that, you can go, there's an external appeal process where an independent third party will review it. So don't give up. Though that appeal right also is there after the fact if a claim has actually been denied, but it is easier to do on the front end and jump through the hoops before than to try to be dealing with it after the fact if a claim has been denied. So trying to get the prior authorizations and that sort of stuff sorted out ahead of time is in your best interest.
Thanks, Louise. And thank you, everyone, for joining us today to learn more about how veterans' healthcare works in America and how our healthcare system works or doesn't work in general. Please text or call in your health insurance and healthcare questions at 202-838-6837, and we'll answer them in future episodes. Join us next week for more on healthcare in America. Be sure to subscribe to my channel or podcast wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.